Hello A&P students, this is Mr. Becker. I am here to go through the structures that we find on our vertebrae. So here I have a cervical vertebra, a thoracic vertebra, and a lumbar vertebra. And you have to be able to tell the difference between these, and you also have to know which structures are in common amongst the three of them. So to cover the common structures, I'm going to set the thoracic and cervical vertebrae back here, and we are going to focus in on the lumbar vertebra. The first structure that we can find on the lumbar vertebra, if I hold it upright, here we have the vertebral body, which you can see is a thick disc of bone. Coming off of the vertebral body, we have the vertebral or neural arch. Sitting in the center of the neural arch is the vertebral foramen, and this is the hole through which the spinal cord is going to pass. The neural arch is made up of several component features. The first, right here and here, are the pedicles. If I rotate to the side, this is the pedicle. See, it looks like a round rod of bone coming off of the vertebral arch, and it joins the vertebral body to this structure here, the lamina. And if I rotate the vertebra around and then take a look at it from kind of the side here, right through here, and then along the back, you can see that we have a large sheet of bone. Lamina means sheet, so it's a large sheet of bone. And then finally, the two laminae, plural of lamina, come together. One lamina here, and they join to the spinous process, which gives the term spine its name. If I turn the lumbar vertebra to the side, we can make out this large round shape to the spinous process. Projecting off of the join between the pedicle and the lamina, we have several structures. The first of these are the transverse processes. And then projecting up and down from there, we have first on the top side here, we have the superior articular processes. And then on the underside here, and here, we have the inferior articular processes. The superior articular process articulates with the inferior articular process of the next highest vertebra, and the inferior articular process articulates with the superior articular process of the next lowest vertebra. All right, so this is what the lumbar vertebra looks like. It has a very large, thick, circular plate-like spinous process, and you can see that the superior articular process has facets that are turned inward, and the inferior articular process facets, if I kind of hold it like this, are turned outward. All right, so we can see those same structural features on the thoracic vertebra, vertebral body, pedicles, the lamina, and the spinous process form the neural arch. The transverse processes project outward on either side here, and then we can see the superior articular process and the inferior articular process above and below those. One of the things to note, the spinous process of the thoracic vertebra is much more arrow-like and downward pointing, and the transverse processes are much rounder. And if I bring it in just a little bit, they have a facet right here. This is the costal facet of the transverse process. This is going to make contact and make a joint with our ribs. The thoracic vertebrae also have two other specialized structures only found on them. The first of them, right here, is the superior costal demifacet, and then down here is the inferior costal demifacet. So a rib makes contact with both demifacets and the transverse costal facet. However, a single rib, so the rib on this level of the vertebra, is going to make contact with the transverse process costal facet, the superior costal demifacet of its own vertebra, and then the inferior costal demifacet of the next highest vertebra. So that means that our ribs make 3 joints between our vertebra, and it takes 2 vertebrae to make those 3 joints. All right, so those are the special features of the thoracic vertebra. The cervical vertebra here has a vertebral body, a neural arch, pedicle, lamina, and spinous process. The spinous process of the cervical vertebra is a bifid spinous process. Here we can see, if I turn it around a little bit, from top and bottom, you can see that there's kind of a heart-shaped flare to both sides that muscles in the neck are going to join to. We can see the superior articular facets here, and the inferior articular facets here and here. And then one of the other main features that changes in the cervical vertebrae is found right here. This U-shaped is the transverse process. And because of the shape of the transverse process, it forms a hole here. This hole is the transverse foramen. And we are going to pass some blood vessels through that when we get to blood vessel material later in the year. So as you can see, we have 3 very different looking vertebrae. You have to be able to identify the class of these vertebrae on a practical. Finally, we do have 2 special vertebrae that you have to be able to identify, and that is first the atlas, and the second is the axis. If we take a look at the atlas, this is our first cervical vertebra. All right, we can see that we have something that looks very different than any of our other vertebrae here. It does not have a vertebral body. It has an anterior arch and a posterior arch here. All right, the vertebral body of C1, atlas, actually is found on C2, right here. This structure on C2 is called the dens. It is a projection up from C2. It joins to C2 instead of to C1 and is the remnants of the atlas's vertebral body. Other than that, C2 looks pretty much exactly like a cervical vertebra. All right, we're gonna bring this one back in to take a look. So the dens is a dead giveaway. You're looking at C2. All right, not having a vertebral body, this open gap here, and then an anterior and posterior arch tells you that this is C1. All right, so C1 sits on C2 like so, and the idea behind this is that the dens and C1 are going to interact and allow for us to turn our head side to side. All right, so these are the vertebrae of our back.